Good. Good evening, everyone. Welcome to the slightly delayed Grey County Family Update. Thank you for bearing with us when we did make the decision to postpone last week due to the windstorm and power outages. For those of you who may not know me, I'm Rob Hatton. I'm the Communications Manager with Grey County, and I will be moderating questions tonight so that Jennifer and Denna can focus on giving you answers to your questions. And I won't take up much of the time, but I'll just quickly go over a couple of things here before we get started. And first of all, I'm just going to share a quick disclaimer just to note that this call is being recorded on Monday, December 20th, 2021. This video discusses matters related to residents of long-term care homes operated by Grey County during the COVID-19 pandemic. Please feel free to share this video with others in the community. And if you have family members in long-term care homes not operated by Grey County, please contact that home if you have questions about their care. And just quickly, our format for tonight, I think we're going to have a brief update from Jennifer, as we did already circulate one last week as a part of the delay. And then we're going to open up the floor to your questions. You can enter them at any time, and we do ask that you use the Q&A feature in Zoom, just because that does help us keep track of everything. And I think with that, I will pass it over to you, Jennifer.
Great, thanks, Rob. Can you hear me okay?
Yep, there's a little bit of background, just static, but I think it's okay.
Okay, that's too bad. I might change the microphone then partway through. Okay, so I am just trying to bring my notes up. Thank you. Thanks, Rob. Thanks, Denna, for being here. Good evening, everyone, and thank you for joining us tonight. We met last virtually on November 9th, and as Rob mentioned, circulated a quick recorded update last week on the Friday. So I'm going to just share my screen and go through the enhanced measures, is what the province is calling it. Hoping that you can see the screen that has a chart on it of long-term care enhanced measures. So these are the changes that came into effect last week. So vaccinations, general visitors who are not fully vaccinated are no longer permitted entry, with the exception of visiting a resident who's receiving end-of-life care or an individual who's medically exempted from vaccination. Infants under 1 year old are not considered visitors, so they are permitted. Caregivers who are not fully vaccinated, so in the province's language, caregivers are designated care partners, who are not fully vaccinated are not permitted entry, with the exception of end of life or medically exempted. They are required to have their first dose of vaccine by December 20th and are required to have their second dose by February 21st. Partially unvaccinated caregivers are restricted to residents visiting in residence rooms. Residents can designate a maximum of 2 caregivers unless they've already been designated. So many of you have already been designated, and that's fine, but any residents who moved in after December 15th are at this time only able to designate 2 designated care partners. And outdoor visits are still permitted for unvaccinated wherever we're feasible, and we are able to do that. Surveillance testing, we have moved really quickly to testing every other day, rapid antigen testing for everyone, fully vaccinated staff, students, volunteers, designated care partners. Visitors, support workers are required to have a negative test upon entry, regardless of their vaccination status, unless they have a negative test from the day before. And testing is now required for outdoor visits. So if you're scheduling an outdoor visit, you need to come and be screened, have the rapid test, and then go outside for the visit. Individuals previously infected with COVID-19 must resume surveillance testing after 30 days. So if you've had COVID within the last 30 days, let the screener know. Visitors, outdoor visits are up to 4 people at a time, and indoor visits are 2. There's no limit for visiting residents receiving end-of-life care, although we do still try to maintain the public health measures. So we are aware of and try to support some distancing and room capacity, but we discuss that on a case-by-case basis. Activities. We are asked to cohort residents for high-risk activities, and high-risk activities are singing and dancing and dining. We discourage they are discouraging large group social activities, so they're just keeping it at a limit of 10 people. And fully vaccinated caregivers and visitors may accompany a resident during a mealtime, but may not eat with the resident. Okay, day absences. So any resident that wishes to go out for a social purpose for the day must be vaccinated. They must be actively screened upon their return and have a rapid test and a PCR test on day 3 and another PCR test on day 7. They are not required to isolate unless that day 3 test, that rapid test is positive for COVID. Essential medical and compassionate absences are continued to be permitted. So if you have someone who's going out for medical appointments, please just check in with the home. Overnight absences for social purposes have been suspended. Residents who wish to leave the home for the holidays or due to COVID-19 may temporarily be discharged and need to follow the readmission protocol. And we have asked for some clearer language, and I've reviewed the legislation that is linked with this. And if a resident leaves for social reasons for overnight, they are giving up their bed. That is how I read the legislation. Admissions and transfers. So residents who are not fully vaccinated require a PCR test before they come and on day 8, and they are required to isolate. Residents who are fully vaccinated do have to do testing, but do not have to do the isolation. Just looking to see if there was anything. And anybody moving in from the community is required to do an isolation. But thankfully, they made this chart because it's a lot to keep track of. And regarding infection prevention and control, the province has reminded homes that we need to be doing our audits and our IPAC assessments and audits every 2 weeks, and we really should be doing them every week if we're in an outbreak. I'm going to stop sharing. Okay. And I have just a couple of other quick things. We've updated the visiting guideline tool, and we did send it around. So that chart, that showed you what you're able to do depending on your vaccine status and whether you need to book it ahead and all of those details. So that chart is available. We are actively working on creating as many opportunities for vaccination clinics at each home as we can to support 3rd doses for staff and DCPs. We are also open if you're a DCP and you wish to have your 1st or 2nd dose, we can help support that as well. And I did just want to highlight that last week, the wait time for between 2nd and 3rd dose has been reduced to 3 months. So it was 168 days, it's now 84 days. So if you're over 18 and it's been 84 or more days since your 2nd vaccine, you're eligible for the booster. We know that these changes have a significant impact on all of your plans over the coming days, and we are committed to doing all that we can to be safe and still find space and time for the joy of the holidays. The teams in the home have many activities and celebrations planned. They aren't canceled, they're just adapted. And I am grateful for Dana being on the call to help us answer questions, and let's go and see if there's any questions. It's a little noisy here. It's the first day of the school break, and there seems to be a lot of activity.
Just while we're waiting for the first questions to come in, and you can use the Q&A feature there. Jen, did you have a headset or something that you could swap out to? I just wonder that might be a little bit better. And if we don't have anything coming in, we won't belabor the point for everyone here tonight. Was there anything that you wanted to highlight or add, Denna, tonight?
I certainly just want to echo what Jen has mentioned is if you are planning an outing, an absence, we really encourage you to give the home a bit of a heads up. It is, as you can imagine, a process, whether it's a day absence, whether you have some questions. We're really taking a look at assessing what the risk would be and trying to mitigate that accordingly. And ultimately, it does take a bit of time. So if you have plans and maybe even coordinating with your family, because with every absence, there is a process in terms, as Jen alluded to and showed in the chart, with PCR testing. So if there are multiple family members who want to visit, maybe there's a way that there can be some coordinating at your own family's level, and then we can coordinate with each of the care communities. Certainly we want to have joy, but if you're looking at visiting, a lot of times it's about coordinating that planned visiting so that we can also manage the swabbing and also assessing what your risks are in the community. If there are unvaccinated members attending a function, that may not be the function you want to bring your family member to, because it then has implications for isolation. So those are the things I would really highlight. Check in with the care community. We can do it. We just want to do it in a way that is supportive for you as well as supportive for the residents.
Great, thank you for that, Denna. And that was perfect. It got the snowball rolling here. We have some questions to get to. So the first question is, are the homes wanting everyone to book visits online through the portal, or are drop-ins allowed as long as it's only 2 at a time? And also, is it also just 2 at a time versus 2 per day?
Right, those are good questions. So the DCPs at this point can still do drop-ins, but as Denna said, it is a busy time. So if you're able to coordinate with other people who are doing general visits, and is the sound a little better, Rob?
Much better, yes.
Okay. So yeah, it's coordinating, because we need to keep 2 visits at a time, and it isn't just 2 per day. Having said that, things can change quickly, and if the numbers continue to really rise, or we're struggling to manage the volume of rapid testing and screening, then we may need to revisit just putting some limitations on the number of people coming and going at any given time.
Okay, thank you. Right, the next question, if we are picking up a resident on Christmas Day, do we have to be tested to do the pickup?
So I'm going to look to Denna. I think technically they're not required by the ministry, but we are encouraging people to do that rapid test for getting into a car together with the resident and going out.
Yeah, and Jen, that's absolutely what we talked with all the care communities. As you can imagine, some of us feel it's a tense time, and we want to make sure everybody is safe and well. And it's a tool in our toolbox, these rapid screening. So if you can come in, as we take an extra 15 minutes beforehand to go get swabbed. And then it's reassuring for us, and for you, it's also a point in time. Now, knowing rapid antigens have to have a certain viral load to detect that it's positive. But again, it's one of the things in the toolbox. It's active screening ahead of time. It's doing the rapid swab, and we certainly would like to advocate for it where we are right now, which is enhanced measures. So that's our preference.
Okay, thank you. I see a couple in the chat, so I'll just quick get those before they get away from me. Are DCPs allowed to take their residents off their home floor, i.e. down to the first floor, or do they have to stay on their home floor?
Okay, I think at this time you can go out of the room if you're a fully vaccinated DCP. Then you can take your go for a walk with your person to another floor. That's right now under the current circumstances. What we do ask though is that You don't accidentally congregate with 6 or 7 other people who may be doing the same thing, because then that gets us into, it kind of gets us away from cohorting, and now we have a group of people doing an activity, even if it wasn't really a planned and coordinated one. So you can, but just keep some distance from other people who may be doing the same thing.
Okay, thank you. All right, if I take my mother out, will she have to undergo quick tests, not the deep COVID test?
So the day trip requires both of those things. So someone goes out for a day trip, they come back. 3 days later, they have a rapid test, which is the quick test, as well as the deep PCR test. So that's the nasopharyngeal, that's the deep one. And then again on day 7, she would have another PCR, which is the deep test.
Okay, thank you. And the last one I see in the chat right now, do any of the homes have COVID in staff or residents?
Okay, good question. So there are no resident cases of COVID in any of the 3 homes. There have been a positive staff member at one of the homes, and a couple of staff at another home who, and maybe actually all 3, who are high-risk contacts and who have had their PCR testing and are isolating at home waiting for results. And what we have done over the last number of months is anytime there's a staff case, we communicate that to the residents and the staff, as well as the designated care partners. We don't generally do a broader media release about that. If there are 2 staff members that are positive for COVID, that meets the definition of an outbreak, and that would require and would warrant a broader distribution of the information.
Hey, thank you for that clarification. Can you just provide a little bit of clarification around if vaccines are required for outdoor visits? It was not reflected in the chart, but maybe something was misunderstood.
Yeah, no, I maybe mumbled over that line. So outdoor visits, oh, Dana,
Yes.
Okay.
So that, there's been a number of communications, as well as 3 meetings that we've attended with Dr. Barb Yaffe with Public Health Ontario, the Ministry of Long-Term Care, and they've made it absolutely clear, particularly with this variant of concern with the Omicron, that there can be, and it appears to be, that even outdoors, there could be some potential spread. So yes, for outdoor visits, you are required to come screen in, get a rapid swab, go back outdoors, everybody is masked. And so it's maybe not as explicit in the chart, but it's in our FAQ, frequently asked question, as well as when it was described to us. So you can imagine that as we're taking a look at this variant of concern, there are some challenges with we'll still be masked, still be distanced, but they're believing that there can be some spread outdoors. And so we're taking all of those precautions. If getting testing is of concern, certainly there are the visits, the window visits, as well as the FaceTime visits. But yes, it is not as explicit in the first chart. But
sorry, the testing is required for outdoor, but they don't have to be vaccinated, right? For an outdoor visit.
For an outdoor visit, you do not have to be vaccinated, okay, but you absolutely have to have testing. And to truly stress the point about coming in, we are making sure there are those conditions, but yes, it's that tool in the toolbox that we want to make sure. So thank you for everyone who's doing it, even in an outdoor visit, if you're having contact with your person.
Okay, thank you. Okay, I was told we would now have to do our own rapid testing. This makes no sense. Older people will not be wanting or able to do this. This seems like the wrong time wrong time to do it anyways with the staff member in the testing room? Can you clarify?
Sure, and that's a great question. And just as you can see from me losing track of the answers to some of the questions, there has been a lot going on in a very short amount of time. So we had gone from rapid testing randomly to ramping it up to every other day. So we have set up in the homes for staff testing, self-swabbing. And this is something that we had explored previously at one of the homes before we were able to kind of drop the regular testing. And some of our colleagues in long-term care homes are in the area have been doing self-swabbing really successfully. So it isn't a must in terms of you must learn how to self-swab. We're offering it to staff to try to support and streamline the process at shift change. You can imagine a home the size of Lee Manor. There's a lot of people coming in that need to be actively screened. They need to be rapid tested. They have to wait for their results or go to the floor, get report, wait to hear the results before they can provide care. So it's an attempt to streamline that process. DCPs and visitors do not have to self-swab. We do have trained staff to support that. If that's something that you are comfortable doing, we have the training video and can do training on site if you'd like to, but you don't have to. And staff don't have to either. But it is something that we have in place just to help streamline that process.
Okay, thank you. On the process of the testing, do visitors have to do a PCR or a rapid test upon arrival?
Okay, visitors do rapid testing.
Okay, thank you. And the next question here, while waiting for the results of rapid tests, DCPs and visitors are often in very close contact with others waiting their 15-minute time period. Is there a solution to this situation which allows better distancing of those awaiting results?
We'll take that comment back. Thanks very much. I know, and perhaps when we have a little more time to look at solutions, some places have like a digital, so the person goes back to the car and they get a text that your test is negative, you're good to go in for the visit. So we'll look at what the solutions might be for that.
Okay, thank you. I think you answered this one previously, but as a DCP visiting a loved one, must we stay in the room at all times, or can we go to the lounge or the ICP?
The only people who must stay in the room with the resident is an unvaccinated or partially vaccinated designated care partner at this time.
Okay. So children under
and Jen, if I could add, just also for those in terms of end of life, we would also, if they aren't designated care partners, but we're also encouraging them to go directly to the resident room and then immediately after the visit to leave the building.
Okay. Right. So children under 12 who only have one dose of vaccine so far cannot visit a resident in their room with a parent who is a DCP.
Unfortunately, that is the case under these enhanced measures.
Are all county long-term care homes allowing their visitors to do their own rapid tests at the home?
It's a good question. The fact that it's a question makes me wonder if perhaps that hasn't been discussed. So we'll take that back and clarify.
Thank you. Okay, this next question is around masking. Today I read somewhere that ordinary masks or floppy masks and that we should be wearing N95 masks. Do either of you have you heard this? This writer thinks they saw it on the CBC.
Yep, it's a good question, and there's lots of information about that right now. I'll take a shot at it, and then Dana can fill in any of the gaps that I miss. There has been updated protocols from Public Health Ontario for long-term care homes and congregate settings with relation to the use of N95 mask. And there was a webinar that they hosted just today at 1 o'clock. So it's all very new and very fresh. And what the change in the recommendation is that staff providing direct care for a resident who is in isolation as a suspect COVID case or a confirmed positive case of COVID, that direct care staff should use an N95 mask. The surgical masks continue to be recommended for all other interactions and care and interaction with residents who are not in isolation for suspect COVID. So if one of your loved ones has a symptom, our protocol is to the nurse does an assessment, they do a swab for PCR, a PCR swab for COVID, and the resident goes into isolation protocol. And in that circumstance, the direct care staff would use an N95 mask until the PCR result comes back. If it's negative, they can switch back to droplet precautions, which is the gown, the mask, eye protection. If they are positive, they would use the gown, the eye protection, and an N95 mask. So in terms of visitors and designated care partners, it has not been recommended that administration staff, designated care partners, visitors switch to N95 use in the case of just the way you're visiting right now. If we were in outbreak and you were a DCP for a resident who was on isolation, we're still discussing what the options would be to be able to support a designated care partner or visitor visiting a resident who has COVID, how we would be able to provide N95 or what that would look like. So all of our staff are mask fit tested for N95. So there's a process that we go through where we try on different masks and it's attached to a machine and we breathe and do all sorts of different things. And it determines whether or not that mask has a good seal and it's a good fit. We don't have the capacity to do that testing for all of the designated care partners, but there are other options, N95s that don't require mask fit. And so we're exploring the options of how we might have some of those on hand for those very special circumstances. And let's hope we don't ever need them. But that's what we were just discussing this afternoon.
Thanks, Jennifer. Did you have anything to add on in that regard, Dana?
The only thing, well, like Jen, you certainly went over it really well. The only thing that I would add is that if you do come in with a cloth mask, we are definitely going to ask that you remove that cloth mask and put on one of the surgical masks that we provide. And I did see a question there saying, are those blue masks surgical masks? Yes, those are the ones that are approved to be used in that context. So rest assured, we're providing you with a mask that is meeting that criteria. But if you do come in with an N95 mask, certainly, you know, with the tight seal, making sure as long as it's not been what the province would call contaminated, maybe wet, if you're coming in from the snow and you're wearing it and it's wet, it's not going to be as effective. So we may ask that you consider switching, if you did have one of those masks that were wet, switching into one of our blue ones, or perhaps you have another supply. So definitely that tight fit, there's some seal test. We're all learning through this. We can perhaps, I'm sure Sherry in your next DCP letter can offer some more information on masks, but yes, the province is recommending that you get a nice tight seal, and the cloth masks don't meet that criteria. So any questions though, let us know, and we're happy to help along the way.
Yeah, and I'll just add, Rob, I have seen on social media some people feeling upset and that they went to visit a long-term care home, not one of ours, and they had an N95 mask on and were asked to change it. So as Dennis said, as long as it is in good condition, it doesn't appear to be wet or soiled, then we would not ask you to take a superior mask off and put on a surgical mask. So if that's something that you wish to do, you can do that.
All right, thank you. And I will just add that I had heard this as well, and I've definitely heard around the efficacy of more layers as well, and people doubling up masks or even wearing a cloth mask over top of the surgical mask as well. And I'm not sure where I would point you to for that for that in literature, other than the same sort of CBC stories, but I've definitely heard that as well.
And just for our homes, we talked about that as well. And we've gone this long with people being really good to wear the surgical masks. And I just worry about introducing cloth masks back into the process. So I'd feel much more comfortable if you want to double up on surgical masks, you can do so. If you want to wear your own N95 or K95, you can do that. But I'll ask you to leave the cloth mask in the car.
Okay, thank you.
And perhaps if we can add to the follow-up, there's a technical brief or an evidence brief from Public Health Ontario about the SARS-CoV and masking. So we can add that as an attachment. I'll make sure I get that one.
Excellent. Thanks, Dana. I'm not seeing any more questions in the chat. So if you have anything that we've missed, we'll maybe just wait a few more moments here and give you an opportunity to put that in
Sure.
the chat or the Q&A.
Sorry, Rob. I had one request from Lee Manor. If you are coming to visit or a DCP screening in, we noticed today that the shift change time 1:30 was really a challenging time. There was a big volume of people waiting to be rapid tested or waiting for the results. So if it's possible to just come a little bit earlier or a little bit later, that would help ease that congestion at that time of day.
Okay. I'm not seeing any more questions, so thank you, Dana. Thank you, Jennifer, for taking the time to be on the call tonight. Thank you to everyone who tuned in to join us, and for those of you who are watching the recording. I don't think I have anything else to add here. Jennifer, would you like to give the final word tonight?
Sure, thanks. So thanks again. I always appreciate all of your engagement and your questions, and the coming days are not going to be easy, I don't think. I think that we're going to see cases continue to rise locally and across the province, but we do have the tools that we need to keep each other safe. I also know that we can find ways to show our love and support that don't necessarily require us to be in the same room together. While it's not what we imagined for this Christmas, we will make the best of things. So please take care of yourselves, be safe, and look for some joy. Thanks, and Merry Christmas, Happy Holidays.
Yes, Happy Holidays, everyone.